Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Various types of the epithelial cells. The first one being the simple squamous epithelium. So simple squamous epithelium, it is the locations being the air sacs of the lungs and lining the heart and blood vessels. So air sacs of the lung and lining of heart, blood vessels, lymphatic vessels. Next is the function is allow materials to pass through the diffusion, filtration and secretes a lubricating substance. So it is by diffusion, filtration and secretes by the lubricating substance. So the simple squamous is present in the air sacs of the lungs. Next is the simple cuboidal. Simple cuboidal, it can be seen in ducts or in secretory portions or small glands. So glands as well as the kidney tubules. And the function is it secretes as well as it absorbs. Then comes the simple columnar. Simple columnar is a ciliated tissue and it is in the bronchi, it is present in the bronchi, uterine tubules, uterus, as well as in smooth that is non-ciliated tissues and are seen in the digestive tract and the bladder as well. This is a simple columnar. Then comes the function is it absorbs and also secretes the enzymes. So it is able to absorb and secretion of the enzyme. This happens in the simple columnar. Then comes the pseudostratified columnar. So pseudostratified columnar is a ciliated tissue and it lines the trachea and much of the upper respiratory tract. So here the trachea, the upper respiratory tract. So this was the pseudostratified columnar epithelium. The function being the secretes mucus. So it secretes mucus as well as ciliated tissue moves mucus. So ciliated tissue, it is also secretes mucus. So mucus is secreted by the pseudostratified columnar epithelium. Then we move on to the stratified. There is stratified squamous epithelium. So here in the stratified squamous epithelium, it lines the esophagus. So stratified squamous lines the esophagus, mouth as well as the vagina. So it is a stratified squamous epithelium. Pseudostratified was in the trachea and the upper respiratory tract, secretes the mucus and the ciliated tissue moves with the mucus. So stratified is the lines the esophagus, mouth and the vagina, and the function being the protection against the abrasion. Abrasion protection. Next we move on to the stratified cuboidal. So here in stratified cuboidal, it involves the sweat glands. So the sweat glands, the salivary glands as well as the mammary glands. So all these are the stratified cuboidal. Cube is present in the sweat glands, salivary glands, mammary glands. So it protects. So protective of the tissue, protection of the tissue is done. Then comes the stratified. The stratified columnar epithelium. Stratified columnar epithelium, the male urethra and the ducts of some glands. So stratified columnar is present in the male urethra as well as in some glands, and it helps in secretion as well as protection. Then comes the transitional. Transitional is seen in the bladder, urethra and the ureter, mainly the bladder. And next is the function is it allows the urinary organs to expand and stretch. So there is stretching function which can be done. To learn and grow daily like this, please do subscribe.